So we've done the evaluation now. You've come, you've met with us. It's been 90 minutes, almost 2 hours. Uh, what comes next? What has the psychologist learned during this time together? Again, when our evaluations are more targeted towards that question of autism, we can provide feedback a little quicker. And so usually, we'd say 9 times out of 10 at the end of our session, we're able to discuss our diagnostic impressions with the parent at the end of that meeting. We will describe how that child's behavior matches or doesn't match the symptoms of autism and kind of what each of those decisions mean. We will then prepare a report. So with Complete Kids in an ABA practice, you won't have that report available when you leave the session, but that will be prepared later and will be certainly shared with you. It would be shared with you directly, and then you are able to share that with other sources and people who know the child and need that information. And so the evaluation is going to result in 4 different decisions. Maybe everything, according to the psychologists and the way you describe them, seem like things are going pretty well. There are hard days and there might be some differences, but none of it reaches the level of a clinical diagnosis. Maybe there is signs of difficulty and delays, but it's not really autism. They might just be a speech delay. Maybe it's ADHD and we just can't sit still enough to focus and follow directions. Maybe it's an experience of anxiety, like the anxiousness keeps them from engaging socially. And so there is a diagnosis there. And here at Complete Kids, what we like to say is if a diagnosis is clear and obvious, and we have the data that we need to give that diagnosis, we will. We'll sometimes give an ADHD diagnosis or a diagnosis related to cognitive functioning, like an intellectual disability, some language disabilities and delays. Um, but again, our goal at Complete Kids is not to provide that deep and comprehensive. And so you may get to that other diagnosis section and say, it seems to be this, or I'm thinking it's this, but we'll need further evaluation to really decide a formal or official diagnosis in this area. Our evaluation may result in saying, like, yeah, I think this child is experiencing the signs and symptoms of autism, but maybe ABA, and what we're going to talk about here with Ruchi in just a second, is or is not appropriate, and that's not what we need. And so we're going to diagnose as having autism, but we'll talk about what services are not appropriate. The last section is to say, hey, it seems like this child is showing the signs and symptoms of autism, and as a psychologist, I think ABA could be helpful. And so the psychologist's role is to say, I think ABA could be helpful. Let me get you connected with those professionals that are really good at doing and understanding ABA.